Okay, so today I want to talk about the skeletal muscles of the body, along with their origins, their insertions, and their actions. And let's start up here with the muscles of the head. And in particular, these are some muscles that are involved in facial expression. So the names of the skeletal muscles can be difficult, but they do tell you, the names do tell you a lot about what's going on. So for instance, this guy here is the orbicularis oculi. Orb refers to circle, oculi refers to eye. So it's a circular muscle that surrounds the eye. Then we'd have down here, this is the orbicularis oris, circular shaped muscle that surrounds the mouth. And both of these muscles are what we call sphincters. These are muscles with circular arrangements of fascicles. And we find these in certain locations. We'll talk a lot about them in about 242 inside the body, bio 242 inside the body, but they also surround, these external body openings that we can see here as well. So what happens when these circular muscles contract? Well, they close. And so not surprisingly, the orbicularis oculi, when it contracts, we close our eyes, we blink. When the orbicularis oris contracts, we close our mouth or we pucker our lips, I guess is a better explanation. Then we have another muscle back here, right there, and that is called the zygomaticus major. Zygomaticus. Well, let's look at the origin and insertion for this. The origin for the zygomaticus major is right up here on the zygomatic bone. And the insertion is down here. It inserts on the skin at the corner of the mouth. Now, what happens when the zygomaticus major contracts? It shortens and it pulls the insertion up towards the origin. And what action does that produce? Smiling. All of these muscles here are innervated by cranial nerve 7, the facial nerve. Okay, then we have some muscles of the head. Okay, so these are also some muscles of the head, and these are involved in mastication, which means chewing. So the first one we have here is the superficial masseter. Here's the superficial masseter here. And what I want to stress here is that a muscle's origin and insertion determines its action. So where's its origin? Up here on the zygomatic bone, that's not going to move. Where's its insertion? Well, it's down here on the mandible. So what happens when the superficial masseter contracts? The insertion moves towards the origin, and that has the effect of elevating the mandible. So it's involved in chewing motions. Another mastication muscle is what's called the buccinator, and that's how that's pronounced, the buccinator. And it's kind of deep a little bit to the superficial masseter, and when that muscle contracts, it compresses the cheeks. You're able to hold food between the teeth during chewing, so it's involved in mastication. And here's some very extreme buccinator contraction, along with some orbicularis oris, and I don't know what the one that causes that right there, but a lot of facial expression. Moving on down to the muscles of the neck, and we have the sternocleidomastoid. And the sternocleidomastoid tells you the reason it's named like that is because of its origins and insertions. So we'll break it down: sterno, cleido, and mastoid. What's sterno going to refer to? Well, that's going to be the sternum. What about the cleido? That's the clavicle. So we look down here. These are both origins. So let's go over here. There's the origin on the sternum. There's the origin on the clavicle, so that's sternocleido. And then the mastoid The insertion point is up there on the mastoid process of the temporal bone. So what happens when this contracts, the origins remain stationary and the insertion moves like so, and that causes lateral flexion of the head or the neck. Muscles of the vertebral column. We have some large back muscles back here. In particular, we have a group of muscles called the erector spinae. And there's 3 of them here, but you guys just have to know them collectively as a group as the erector spinae. There's the iliocostalis, longissimus, and spinalis. And the origin for all of these are down here, okay? The sacrum, the iliac crest, the lumbar vertebra. So all the origins are down in this region. And the insertion points are here on the upper back. So what happens when these contract? Well, the origin, or the insertion, moves towards the origin, and that causes back extension. Okay, then we have the abdominal muscles. And there's 4 layers of abdominal muscles that make up the abdominal wall. And these are involved in motions like flexing the back here, rotating the torso or the trunk. And also these abdominal muscles are part of your core, and they're involved with stabilizing the pelvis and the lower back. So we have 4 different abdominal muscles. We have the external abdominal oblique. Then we have the internal abdominal oblique underneath that. Then we have the rectus abdominis underneath that. And then finally, the most deep, we have the transversus abdominis. So 4 different layers of abdominal muscles. And something else that I need to point out is a structure called the linea alba. This is the linea alba right there. And it's a strap of connective tissue that runs down the midline of the abdomen. It runs from the xiphoid process down to the pubic symphysis. And basically what it is it's an insertion point. Well, it's basically where it's formed by the convergence of a lot of these abdominal aponeuroses here, but it serves as an insertion point for these abdominal muscles. So the outermost, the most superficial abdominal muscle is the external abdominal oblique. And in this case, the muscle fibers run downward and kind of a little medially, like so. The same direction as if you had your hands in your pockets. But the origin is the outer surface of the ribs here, and the insertion is on the linea alba. So what happens when these contract? Well, when they both contract, when both sides of the external abdominal oblique contract, it results in vertebral flexion and compression of the abdominal wall. But if you just have one side that contracts, for instance, then that's going to be involved in trunk rotation, in rotating the trunk. In particular, it's going to rotate to the same side that that muscle is on, because muscles pull, they don't push. Here we have some extreme abdominal muscles here. We haven't talked about these yet, but those are the rectus abdominis. And then you can see the external abdominal obliques right there. Anybody know what those are? That's your serratus anterior. All right, then deep to the external abdominal oblique, we have the internal abdominal oblique, and most of these fibers are going to run upward and a little medially. Their origin is on something called the thoracolumbar fascia on the back down here at the back, and then you have the insertion on the linea alba. And pretty much the actions of the internal are the same as the external. Okay, then we have the rectus abdominis, And the rectus abdominis, the origin is down here on the pubic crest and the pubic symphysis, and the insertion point is up here on the xiphoid process and also these costal cartilages. And what happens when the rectus abdominis contracts? It flexes the lumbar region of the vertebral column. So back flexion, vertebral flexion. And then lastly, we have the transversus abdominis. And the transversus abdominis, I mean, really just wraps around the body here. The origin is on what we call this lumbar fascia down back here, which you can't see. And then the insertion is on the linea alba. Now, when this muscle contracts, it compresses the abdominal contents. Okay, it brings the abdomen tight into the middle of the body and really stabilizes your core. So that's what you're working when you use when you're doing planks. And something else actually I found out about this muscle, I was at a chiropractor the other day, is that the transversus abdominis, the origin is back here on the lumbar portion of the spinal cord, and when the transversus abdominis is strong, it's healthy, it pulls on the lumbar vertebra like so, and it supports the lumbar curve. If you remember, you have a cervical, then thoracic, then a lumbar curve, and the transversus abdominis pulls on that, and so it supports your lumbar curve. So it's good for posture, good for back integrity, vertebral integrity. And then this just shows just all the different layers of it. We can start on the outside. Here's the external abdominal oblique, and then this is the aponeurosis for that attaches to the linea alba there. Then we have the internal abdominal oblique, that aponeurosis. Then we have the rectus abdominis, like so. And then the deepest of all, the transversus abdominis. Okay, now we're going to keep moving on down. These are muscles of what we call the posterior thorax, and these are specifically going to be involved in scapular movements. So these are going to be involved in moving the scapula. And the big muscle we want to look at here is the trapezius. And there's a few different parts of the trapezius. We have what are called these upper fibers. We have, actually I'm going to go upper. So we have these middle fibers, and then we have these lower fibers. Now this diagram over here shows you the origins and insertions for this. So the origins are up here on the occipital bone, the spinous processes of the cervical and the thoracic vertebra are pretty much all of the origins. And then the insertion points are on the scapula. And you can see right there along the scapula, and then it continues on to the clavicle over here. So when all of these fibers contract, it leads to stabilization of the scapula, and it allows the scapula to serve as a fixator muscle. But what happens if the different parts of the fibers contract? So for instance, what happens if the upper fibers contract? What happens if the middle fibers contract? What happens if the lower fibers contract? And what happens is that we have different types of scapular movements, because these are all attached to the scapula here. So I'll let you assign these different scapular movements to contraction of these different trapezius muscle fibers. So for instance, depression of the scapula here, which fibers of the trapezius need to contract to allow for depression of the scapula? Okay, now we're on the anterior thorax, and we're going to talk about the pectoralis minor. The pectoralis minor, the origin is on the ribs here, and the insertion is on the coracoid process of the scapula. Okay, that guy right there. So what's going to happen with this contracts? Well, the insertion moves towards the origin, and that causes protraction of the shoulder. Or another way to look at it is abduction of the scapula. It takes the scapula and it moves it away from the midline, which is the same action as protraction of the shoulder. Okay, now we're going to move on to shoulder joint muscles, and particularly, well, we're going to move on to shoulder joint muscles. And shoulder joint muscles are involved primarily with movements of the arm. So these are shoulder joint muscles because these muscles cross the shoulder joint. Okay, so here's the pectoralis major. If there's a pectoralis minor, that implies that there's a pectoralis major. And the origin is on the clavicle, is on the sternum, and also the ribs as well. And then the insertion is on the humerus here. Okay, so these muscles are crossing the shoulder joint. They're moving. They're moving across the shoulder joint. And when a muscle moves across a joint, it's going to result in action at that joint. So the pectoralis major does a few different movements. One, if your arm is already in this abducted position, what it does, like so, is when it contracts, it moves that insertion down back towards the origin, and it causes adduction of the arm. Couple other motions that it does: horizontal flexion. Okay, the way I think about this, is that the pectoralis major is right there, and it's grabbing onto the humerus. So when the pectoralis major contracts, it's moving the humerus. Okay, it's grabbing it right there and moving it in towards the origin. Medial rotation of the arm is something else that it's involved in. Again, these are just some other motions if you want to really work your pectoralis major. These are all different exercises you can do, but there's actually a couple different parts of the pectoralis major. There's this larger part that we call the sternal head, and then this up here is called the clavicular head. And the sternal head assists in shoulder extension. So, boom, moving it like so, grabbing onto that humerus and moving it back. And the clavicular head is involved in shoulder flexion. Okay, moving that humerus up. This guy's wearing safety glasses for some reason. Continuing on with these shoulder joint muscles, here we have the deltoid. The origin for the deltoid is the scapula. In particular, well, we start over here. Actually, we have the clavicle, and then we have the acromion process in the spine of the scapula. So these are all the origins, and then the insertion is on the humerus here. So what's going to happen with this when this contracts? When all of them contract simultaneously, the deltoid is the prime mover of abduction of the arm. Okay, so the primary muscle responsible for abduction. But again, we have these different fibers, and different fibers can contract. When we can consciously tell, these fibers or these fibers or these fibers all to contract. And when the anterior fibers contract, that leads to flexion of the arm. When the posterior fibers contract, it leads to extension of the arm. When the middle fibers contract, again, abduction. All right, now we have the latissimus dorsi. So here's the trapezius right there, large back muscle, and then the other super large back muscle is the latissimus dorsi right there. And again, this is attached to the humerus down there, or up there, I guess. And then the origin for this are the spinous processes of the thoracic and the lumbar vertebra, along with the iliac crest. So you see something that's attached to the humerus, it's going to move the humerus. So the latissimus dorsi is a powerful mover of arm extension. Okay, taking these arm muscles and extending them back. And so swimmers, in particular butterfly swimmers, will have these huge, latissimus dorsi, this kind of V-shaped torso because of the latissimus dorsi. And I just threw this up here. These are, these are just some muscles that are involved in, doing things like push-ups, pull-ups. They involve a lot of different muscles, including the latissimus dorsi here. You're taking yourself and basically lifting yourself up. It involves the lats, the pectoralis muscles, biceps, all that kind of stuff. Same thing with push-ups and with bench press. You're involving a lot of different muscles. Okay, now let's look at the limb muscles, and in particular we'll start with the elbow joint muscles. And what we're talking about here are the biceps, and there's two different bicep muscles. There's the biceps brachii long head and the biceps brachii short head. And I should say that this is considered one muscle with what we call two origins or two heads. So this is one head, that's another head there. And you guys have to know these individually. And so the first one, the biceps brachii long head. This one is the lateral of the two. So this is the biceps brachii long head. And the origin is right up here above the glenoid cavity. So this has a super long tendon that comes across the head of the humerus. It inserts there right above the glenoid cavity. And the insertion point is down here on the radius. Then we have the biceps brachii short head. This one is medial, and the origin for this is the coracoid process of the scapula. So this little beak-like projection of the scapula is where the short head attaches to. And then again, it inserts down there on the radial tibiosity. So what we're doing here is we're crossing the elbow joint. So what happens when these muscles contract? Well, the insertion moves towards the origin, and that causes elbow flexion. Another muscle, this one is deep to the biceps muscles, is the brachialis. This is the brachialis here. Again, it crosses the elbow joint, and this is also involved in elbow flexion. Okay, now on the other side of the arm, we have the triceps. So this is a posterior view right here. And the triceps has three different heads. And these are difficult too, and you have to know these. But we have the triceps brachii long head. This is the triceps brachii long head. This is that's the triceps brachii long head, triceps brachii lateral head. And the origins here are up here on the scapula and also here on the humerus. Then we have a third one that you can't really see. It's the triceps brachii medius is in back here. But this is all the same muscle. It has three different origins. It has three different heads to it. So the trick with all of these muscles is that all three of these triceps merge into this structure called the triceps brachii tendon. And you guys have to know the triceps brachii tendon. And the triceps brachii tendon inserts on the ulna, in particular the olecranon of the ulna. So it crosses the elbow joint and inserts on the olecranon. And basically this serves as the insertion point for all of these triceps muscles up here. All these triceps muscles merge into the tendon, and the tendon inserts on the olecranon. So the olecranon is the insertion point for all these triceps muscles. It crosses the elbow joint. When it contracts, it results in elbow extension. And then here's just some other muscles that I'm not going to hold you responsible for, but are just interesting to know. Okay, we talked about supination versus pronation. Well, there's muscles that cause that action. There's a pronator teres and a supinator muscle. These ones you just have to know as a group. So, and the name tells you what they do. The flexor carpis. Well, there's two of them. What are they going to do? They're going to result in wrist flexion. And here you can see these muscles come down and their tendons cross over the wrist joint and they insert here on the metatarsals. The metacarpals. They cause wrist flexion. These are the extensor carpis, and there are three of them. And again, these cross over the wrist joint. Now this is a posterior view, so they cross over the back side of the wrist. So these result in wrist extension, wrist flexion, wrist extension. Okay, moving down to the hip joint, and these are muscles that cross the hip joint. They're going to be involved with movements of the leg, and the big guy back here is the gluteus maximus. Okay, here's the gluteus maximus. The origin is on the little bit of the ilium and also the sacrum here, and then the insertion point is on the proximal side of the femur. And this is a large, powerful muscle, and in particular what it does is when it contracts, it draws that insertion point back and it results in hip extension. It's the prime mover of hip extension. Well, if there's a gluteus maximus, then that means that there's a gluteus medius, or one that's smaller than that. So here we have the gluteus medius that is a little deep to it, a little in front of it. The origin is up here on the ilium, and the insertion point is on the greater trochanter of the femur. Now when this guy contracts, what's going to happen is it's going to pull that femur out and result in abduction of the hip. So it grabs onto that greater trochanter and pulls it out. All right, what do I want to say about this? I better pause it and review it. Okay, so this muscle right here is called the tensor fasciae lati, like a fancy coffee drink or something like that. The tensor fasciae lati. And the origin is up here on the iliac crest, and then the insertion point is a little different. It inserts on this structure right there, which is called the iliotibial tract. Maybe you've heard of it as your IT band. And what this is it's a thick band of deep fascia that inserts basically on the tibia down here. And what this is all good for, one of the things that the tensor fasciae lati does is when it contracts, or it always has a little muscle tone, it pulls on the tensor fasciae lati, and this steadies the knee. Okay, it makes the IT band taut, makes it tight, and that steadies the knee. It stabilizes it. Okay, a couple other muscles. I just added these last quarter, but these are collectively called the iliopsoas muscles. But I believe on the lab exam I have you know them individually as the iliacus and the psoas major. And both of these, here's the different origins of them right there, but both of these insert via a common tendon on the femur here. And what these muscles are going to be involved in is when they contract, they pull that leg, can't draw it right here, they pull it forward. So these muscles contract like so, they pull on the femur, and they cause that femur to move forward. So this is the prime mover of hip flexion. Another muscle involved in hip flexion is called the sartorius. Big long muscle that starts here up on the ilium, runs all the way down, moves medially, and it inserts near the tibial tuberosity right there. And again, this contracts, and it moves this, contracts like so, and it brings the, I don't know how to draw that, but it brings the leg up, brings the tibia out, and results in hip flexion. Okay, then we have muscles called the adductors, and this is a large, deep muscle mass consisting of 3 muscles. Okay, so there's the brevis, longus, and magnus. You guys just have to know these collectively as the adductors. I can put any of these 3 or all of them on there, and you just have to know them as the adductors. But the origin here, I don't have that up here, but we can just look at it. The origin is on the pubic crest, it looks like, and then the insertion point is on the medial side of the femur. So just looking at it, what does this do? When these contract, moves the leg in like so. So this is involved in a deduction of the hip. Okay, all these motions here are occurring at this ball and socket joint. Okay, down to the lower limb, now the knee joint muscles. And we're on the anterior side. Should write that up there. Okay, so this is an anterior view. And the muscles that I want to look at here are the quadriceps. And again, this is one muscle with 4 different origins. And you guys have to know all of these individually. So, the first one here is the rectus femoris. And you can see the origin is up here at the ilium. Then we have the vastus lateralis. Lateralis, it's lateral. And the origin is up here on the greater trochanter of the femur. Then we have the vastus medialis. Again, the origin's on the femur. And then deep to this, and what I did here is I removed the rectus femoris so you can see underneath the vastus intermedius. And again, the origin's up here on the femur. So we have the quadriceps, 4 different muscles here, or 4 different heads of muscles that are all part of the quadriceps. And their origins are either up here on the ilium or on the femur. Now what happens is the quadriceps all converge on the patella, on the kneecap. And what happens, so let's see. Yeah, so the tendons for all of these muscles converge on and insert on the patella. And then the patella is attached to the tibia, specifically the tibial tuberosity, by this patellar ligament right there. So essentially what's going on here is that all of these quadriceps muscles up here, all of their insertion points are down here on the tibial tuberosity. And that occurs because of this patellar ligament right there. And so this is how these quadriceps are crossing the knee joint, because these are involved in knee joint motions, right? Yeah, so what happens is when the quadriceps contract, they pull on that patella, which pulls on the patellar ligament, which pulls on the tibia, and results in that motion, which is leg extension. or extension at the knee. I also want to point out that the rectus femoris is also involved in hip flexion. Okay, now we're here on the back side of the leg. So this is a posterior view, and now we have the hamstrings. And there's 3 of them. This is the biceps femoris long head. The origin is here on the ischial tuberosity, and the insertion point is down here on the fibula. Then we have the semitendinosus, origin again on the ischial tuberosity, insertion point around on the tibial tuberosity, and then we have the semimembranosus, origin ischial tuberosity, insertion down here on the medial epicondyle of the tibia. So these are all crossing the knee joint. And what happens when these contract? Well, the action occurs at the knee joint, and that's going to result in knee flexion. And this is kind of cool. This just shows you some of the compartmentalization of these muscles here. So here's the femur, here's the hamstrings and back. This is this is where actually all these are the quadriceps, and then these are where some of the adductors are located. Okay, then finally down here at the ankle joint, okay, these are lower limb muscles, and so these muscles are going to be crossing the ankle joint, and specifically we have the gastrocnemius, and we have the gastrocnemius medial head and lateral head, and you can see that their origins are up here on the femur, on the femoral condyles. We also, deep to this, have another muscle called the soleus, or soleus, I'm not quite sure, and that's inserting up here, or the origin is up here on the tibia. Now, all of these muscles cross the ankle joint, and they cross the ankle joint because of a structure right there. What's that structure? That is the Achilles tendon. So all of these muscles, just like the triceps they merge into this tendon, this being the Achilles tendon, and where are they inserting on? They're inserting on the calcaneus there. So when these muscles contract, they pull up on the insertion, that raises the calcaneus, and that results in plantar flexion. And there's another, deep to all those, there's another super small muscle that crosses the ankle joint, and it's called the plantaris, and this always is amazing to me, but it has this super long tendon that comes down, crosses the ankle joint, and also assists in plantar flexion. So if there's plantar flexion lifting up on that joint, what about dorsiflexion? Well, that's the job of this muscle right here on the anterior side of the shin. This is the tibialis anterior, and when it contracts, it pulls the toes up and results in dorsiflexion.